27, 28, 29, 30.
Now that you've practiced providing compressions, it's time to add the next important skill of infant CPR, giving breaths. Infants often have healthy hearts, but even an infant's heart can stop beating if the infant can't breathe or is having trouble breathing. So it's very important to give an infant breaths as well as compressions. Many cardiac arrests happen at home or other settings where barrier devices may not be available. Mouth-to-mouth breathing is a quick, effective technique used to provide oxygen to an unresponsive infant. When you give breaths to an infant, they should be long enough to make the infant's chest rise, about 1 second. When the chest rises, you know the infant has gotten enough air. Let's look at the steps for opening the airway and giving breaths to an infant. You'll get a chance to practice a little later on. For now, just watch. Opening the airway correctly will help keep an infant's tongue out of the way. To open the airway, tilt the head back and lift the chin. It's important to avoid pressing into the soft part of the neck or under the chin because such pressure might block the airway. Also, don't push the head back too far. This might close the airway as well. The next step is giving breaths. While holding the airway open, take a normal breath. Cover the infant's mouth and nose with your mouth. Give a breath for about 1 second. Watch for the chest to rise. Give a second breath, blowing for 1 second again. As you give each breath, look down at the infant's chest to see it rise. If you give a breath and the chest doesn't rise, quickly reopen the airway by allowing the head to go back to the normal position and then opening the airway again. Give another breath and make sure the chest rises this time. Remember, you want to give 2 breaths in less than 10 seconds to minimize interruptions in compressions. After giving 2 breaths, start pushing hard and fast in the center of the chest again.